Good morning, and it's a new time. Yesterday was budget, so we'll be back to Thursday next week at 1 o'clock. So I appreciate people that are here today and talking to people of Rhode Island as well. So again, I echo this over and over again, but it's well deserved. Dr. Alexander Scott and Commerce Secretary Pryor, thank you so much for your leadership. And joining me today is Tom McCarthy, who's Executive Director of the state's COVID response. We'll make a few comments, but more of an introductory to the people of the state to know that we're really working very hard to make sure that vaccines get in people's arms. So for me, this is day 10 of being in the governor's office, and we've been busy encouraging efforts to get shots in the arm. So on Tuesday, we announced an ambitious plan to meet President Biden's goal of getting first doses to COVID-19 vaccine to all teachers, school staff, daycare workers by the end of the month. And I think you'll hear today that we're on track. I know that I'll be at several sites today where hundreds of school teachers and personnel will be getting vaccinated. So getting this population is really an important thing. It's the right thing for us to support our students, our families, schools, and the economy. Beginning this week, some of our state's 30 cities and towns are going to be running vaccination clinics, getting the vaccinations to our teachers and school-related staff. I want to thank the municipal leaders once again for stepping up in a way that is going to really help us. I'll be in Smithfield, Cranston, and Bristol visiting a few of these clinics later today and be overlooking to see how the process happened. I just got a nice text from Mayor Bordelli Hunt, and she's going to be active from 9 o'clock to 5 o'clock today in Woonsocket, working with North Smithfield and Woonsocket in a partnership between 9 o'clock and 5 o'clock this afternoon. So it's just a reminder to all our teachers and daycare workers to make sure that they're connecting in with their local districts to make sure that they will be hearing about the appointments directly from their local districts and respond when they do. And the emergency management directors will reach out to all the school leaders and Department of Human Services licenses for child care centers to share information and let people know how the process is going to work. But it's active and it's running now. So I know there's been a lot of news this week. This is an important point that I want to make to all Rhode Islanders. Yesterday we announced Rhode Islanders ages 60 to 64 and 16 to 64 with underlying conditions can now make appointments to get their COVID-19 vaccine. Help spread the word and encourage everybody to follow up on getting appointments. That's going to be very important as our vaccine supply increases. So our goal continues to be to get as many people vaccinated as quickly as possible. And we ask all Rhode Islanders to understand that these shots are important to keep us safe, keep us out of the hospital, and sadly, make sure that we don't have any sad occurrences with death rates that we certainly don't want. Last night we heard from President Biden once again in terms of creating a goal of making every adult eligible to receive COVID-19 vaccine by May 1st. This is exactly why our team has been focusing over the last month or more to build our capacity. We know that vaccine is coming, and we need to be prepared to make sure that we have the capacity both on a municipal level and state level and with our pharmacies to make sure that whatever we receive, we are going to get into arms as quickly as possible. Yesterday, I had actually the privilege of talking directly to Dr. Fauci to talk about Rhode Island's COVID-19 response, a one-on-one conversation. And I was glad to share the news about all the work that is being done here in Rhode Island, and in particular the new news relative to teachers. He was very pleased that we were following the President's directive, and we also agreed that we would follow up with our full team to talk to him about vaccine hesitancy, which is a very important topic that you're going to hear more about today. So today we're also additional relief to the restaurants, local restaurants, in our effort to kind of do this incremental advancement of reducing the restrictions. based on, again, I'm going to mention again that this is all based on a really high level of discipline, that we are following the protocols that are currently in place. This is what's going to allow us to open up the economy, in addition to making sure that we're really rolling out the vaccine. But we really need to have strong adherence to the protocols in order for this to continue at the pace that we're rolling it out. So restaurants can reduce table spacing from 8 feet to 6 feet, and bar patrons who are also eating food can stay at the bar until midnight. And our goal is to continue to identify areas where we can provide businesses with flexibility that will not impact our positivity rates or our hospitalization rates. And we will keep moving towards that goal safely. If our vaccination rates keep up and our positivity rates is stable, we expect to have announcements on broader reopening of our economy next week, which I labeled as daylight savings time, which is Sunday. So next week we'll be working steadily on that to continue to provide the flexibility that our local businesses need to survive this pandemic. This requires Rhode Islanders to do that part again. And I repeat again, please, be very diligent, be very disciplined on the protocols that are in place. And as we get closer to the spring, we also want to make sure that our local garden shops are on a level playing field, and with any of the big box stores. If you recall, last Easter, they were at a distinct disadvantage. This year we want to make sure that all our farmers and garden shops are on a level playing field. And we encourage, continually encourage, let's support our local small businesses. This is the time to do it. They need our help, and our local communities benefit when we support the local businesses right now. So in a minute, I will have Secretary Pryor will go into more detail on the restrictions surrounding small garden shops and broader reopening to come. I'll wrap up again. I know it's repetitive, but I think it's worth repeating. Let's get the vaccines out of inventory into arms, increasing capacity so when vaccine supplies do arrive, we are ready to go, supporting our communities as we merge municipal vaccine sites into strategical regional sites, opening additional state sites, and engaging our cities and towns to vaccinate teachers, school staff, and daycare workers. Again, it only works if we work together.